My name is Bethany Colder. I'm the Business and Operations Manager / Admissions Director at the University of Colorado Physician Assistant Program. I am so happy I have the opportunity to share a little bit about our wonderful program with each of you. Before I get started, please know that all the information I'm going to be presenting is also available on our website, so don't feel like you have to take too detailed of notes. So what is a PA? A physician assistant is a licensed mid-level health professional. So if you have students coming to you that are interested in becoming a nurse practitioner, there are a lot of similarities there. PAs have autonomy working collaboratively to varying degrees with a supervising physician, meaning if they're in a difficult case or they're right out of graduation, they will probably consult more with their supervising physician. And for the past several years, the number of PAs in clinical settings have been increasing rapidly. You or your students may be seeing a PA or an NP for primary care and not even know that they're not a physician. So what can they do? PAs can perform physical exams and take patient histories, diagnose and treat illnesses, order and interpret laboratory results, assist in surgery, write prescriptions, provide patient education and counseling, and so much more. The PA profession is very commonly in the top 10 for Forbes' best master's degree for jobs. There's a huge demand for PAs as healthcare shortages continue and combined with an aging population. I've included the 2023 AAPA data on distribution of PAs by specialty, and these percentages do tend to stay pretty close to this breakdown year over year, with psychiatry coming into play in this latest edition of the data. As you can see, family medicine, primary care, orthopedic surgery, and emergency medicine make up the top 30% of the specialty breakdown. However, any setting that you could find a physician, you can almost certainly find a PA. So the real question, how do you become a PA? This is a very simplified process overview of how to become one. First, graduating from an accredited PA program. After that, you have to pass the certifying exam, which is called the PANCE. After that, you have to have a state license and then work with a supervising physician. And then every 2 years, you're completing 100 hours of continuing medical education, and then every 10 years, passing your recertifying exam. So we've looked at how to become a PA. We'll focus now on the PA education portion and overview. Like NPs and MDs, PAs are trained in the medical model. On average, the total amount of time that PAs are in school is usually around 27 months. Our program is a little bit on the further end of the spectrum, being 35 months in length. Currently, there are 306 accredited PA programs nationwide, although more and more are added every year. PA programs provide education in general medicine, and then if your students have a specific specialty that they are interested in pursuing, most of that training will be done on the job, either through postgraduate or fellowship programs. Here's another graph that we have from the AAPA. This is showing the median compensation from primary employer by major specialty area. It is important to note that this data reflects salaries for PAs who've been working for 6 to 7 years, so starting salaries can tend to be about $10,000 to $15,000 lower per year depending on the region and the specialty. And this is a picture of our program's founder, Dr. Henry Silver. He was a professor of pediatrics and not only the founder of our program, but he was also responsible for starting the first nurse practitioner program in the country. Here we've got our mission, which is to provide comprehensive physician assistant education in primary care across the lifespan, with expanded training in pediatrics and the care of the medically underserved. And it's a very condensed timeline of our program from the founding in 1968 as the third PA program in the country to 2003 when we moved to our current location on the Anschutz Medical Campus, all the way through to the launch of the Colorado curriculum in 2018, which I'll discuss a little bit later. So the big question, why CHA? 1. It's part of a world-class medical institution. We're located on the Anschutz Medical Campus along with Children's Hospital Colorado and the University of Colorado Hospital. There are opportunities to participate in research and collaborate with students in other School of Medicine programs. We provide education across the lifespan with additional training in pediatrics. We offer a leading-edge chief complaint-based curriculum, which means we're teaching students how does a patient present in a clinical setting. And I'll discuss our curriculum in more detail next. There's the opportunity to participate in robust simulation and standardized patient programs. Part of the leading-edge curriculum incorporates simulated patient experiences in a setting that is staged to look like an exam room in a clinic, and allows the student to put their classroom learning into practice with feedback from standardized patients and faculty several times throughout the year. One important thing that we do in our program that's a little bit different than others is we start clinical rotations in the first year. Much like our classroom curriculum, our clinical experiences start off in smaller rotations in the first year, usually focused more on shadowing the preceptor and getting more hands-on experience being in a real clinic setting. And these rotations increase in frequency and length throughout their second year and going into the full-time clinical third year. We do offer tracks, Global Health Change, which is an adult hospitalization, and Pediatric Critical and Acute Care. These are specialized learning tracks for students who want a more targeted curriculum path. And these are usually highly competitive, and it's not a requirement for any of our students. And last but not least, we do boast an excellent PANCE pass rate. Over the past 5 years, our average among first-time takers is 96%. Next, I'll go a little bit more in depth into our Colorado curriculum. It's a 3-year full-time in-person program that starts each year during the summer semester. We're really grounded in our educational approach in learning theory and the principles of evidence-based education. And as I mentioned in our previous slides, the biggest difference in what sets us apart is that it's based on clinical presentations rather than traditional courses. In the schedule slide that you'll see in a few minutes, you won't see typical classes like biology, anatomy, physiology. You'll see cardiovascular, pulmonary, or endocrinology and reproduction. And it's really designed that way specifically to build progressively on the knowledge that we teach from one year to the next, and across the curriculum, longitudinally assessing skills as we present them, making sure that our students are understanding what we're presenting each time. When our faculty was developing the Colorado curriculum in the years leading up to the 2018 implementation, they really wanted to focus the entire curriculum through a lens of values. And I'll go into a little bit more specifics on a few of them. So first is that it's integrated. We don't have anatomy class, physiology, nothing is separated out, everything is combined. Basic and clinical sciences and skills with professionalism and clinicianship. Contextualized learning, as I mentioned, everything is in the context of what you'd be doing in clinic during your rotations, and then even after that when you've become a PA yourself, in how you would be actually interacting with patients. Learner-centered, we like to think of it that the student's job is to learn, and that it's our job as the program to make sure that we're providing the most conducive environment and optimal learning situation for them. Continuing on with the curriculum values, our next one is that it's competency-based. Every curricular component is contributing to learner performance of professional competencies that we can expect from them in clinical practice, that they should be able to do on a very frequent basis, things that are done once they're actually seeing patients. Our curriculum is also adaptable, innovative, and dynamic. We wanted to be able to respond to changes that arise and are highlighted in our feedback surveys and experiences as we continue to implement and update our curriculum. Sustainable. We want all of our stakeholders to be emotionally healthy and prevent burnout, especially for students. It's one of the biggest perks of having a 3-year program is that our didactic portion is spread out a little bit more. There's room for more breaks and a little bit less drinking from the fire hose in terms of learning content. And all of those values really lead into the self-directed learning expectation that we have for our students. Self-directed learning is critical to the development of lifelong, independent, critically literate learners and practitioners. And these are some of the expectations that we have for students, as well as for faculty, to foster the love of learning and finessing a skill that our students will use throughout their time in the program and as they work throughout their career. This is the scheduling slide that I had mentioned earlier. This one shows the structure of our curriculum over the 2 didactic years. There are system blocks that occur over year 1 and then again in year 2 during that same time period within a given year. And during the first 2 years of the curriculum, students will be exposed to a total of 68 clinical presentations that will fall within one of the system blocks. And these clinical presentations will be discussed 1 or more times throughout the first 2 years of instruction. And then you'll kind of see this threads portion right here. These are occurring in conjunction with the system blocks, and the content that's covered in these will enhance the medical knowledge and medical topics that students will be receiving within the system blocks. And the threads are designed for the application and practical skills that students would need as a clinician, and they'll relate to the medical knowledge and clinical medicine that the students acquire within those blocks. One of the specific threads is clinical experiences, and these occur 1 day weekly. And then I'll talk a little bit more about clinical rotations in a few minutes. And on this slide, I'll do a little bit more of a breakdown in terms of what the presentation of a specific symptom would look like across the week. So say you're in cardiovascular pulmonary, and the example that's given is shortness of breath. We want the students to start thinking about maybe asthma in kids, COPD, pulmonary embolism, or emphysema, things along those lines. And then we're also taking into account that all of these instructions and learning will be given in the context of shortness of breath. So we'll be covering anatomy, physiology, pharmacology, all of these things, keeping in mind that they are related to that specific presentation of shortness of breath. And then the integration and the depth that we go into these specific topics will increase as this course is repeated in that next didactic phase. And our clinical experiences are all about increasing our students' sense of comfort in terms of being in a clinical setting. And this is covering various medical specialties and in diverse locations, sometimes even international. Starting out with the first year in clinical boot camp, working all the way up to the 3rd year, where it is a full-time clinical rotation and very little is done on campus in terms of didactic training. And these slides cover that 3rd year. It's 10 full months, like I mentioned, of full-time clinical experiences covering various specialties. Most of these rotations will occur within the state of Colorado. There are limited options if a student wants to reach out and work in a specific state other than Colorado. That is really up to the discretion of the clinical team and our preceptor availability. And then on their 3rd year as well, in terms of clinical experiences, they're also working with the clinical connections. And this is the 2-semester course that culminates with their capstone project in May, where they're talking about a specific case and how they can apply what they've learned to their professional career going forward. These next few slides will cover our tracks in a little bit more detail. This first one is our global health track that's focused on equipping MDs and PAs for the skills that they'll need for global and public health service. It includes additional elective rotations internationally, as well as additional didactic and clinical coursework and in-depth projects. They like all of the other tracks, will apply in their first year once they're already in the program, so this is not something that your students that you're advising need to worry about beforehand. For this particular track, 2 students are admitted per class. The next track is Pediatric Critical and Acute Care. This one is a special partnership that we have with Children's Hospital of Colorado, and it's specialized instruction, clinical experiences in pediatric critical and acute care. It's over all 3 years with targeted readings and lectures, specific rotations as well. 4 students per class can be admitted for this one. We've had a lot of students that have participated in this track go from being students into working at the Children's Hospital. Next is our Care of the Hospitalized Adult and Novel Graduated Experience, or shortened out to CHANGE. This one is in conjunction with the University Hospital. Much like with Children's, they work exclusively there for these specialized rotations, and it really prepares students for careers in general hospital, but also intensive care units and then consult hospital services. And for this one specifically, there are 2 students that can be admitted per class. This next slide shows the proposed tuition and fees for the next 2024-25 academic year. These are still pending in terms of being approved by the regents and may be subject to change. We'll have a little caveat at the bottom. So for the 3-year program, the expected tuition for residents would be $67,000. It goes up significantly for non-residents, but we do allow after the first year for students to petition to change their residency status to resident, so that the non-resident students could potentially pay only $94,000 for the whole program, as long as they're granted their residency status change. Which is why it's important for students when they're here to petition for that change as soon as possible, which is usually in June or July. And here's the little caveat. The tuition increases are determined yearly by the regents and can range from 3 to 10% increases. To help offset some of that cost, we do offer some scholarship opportunities. These are just a selection of them. But there's more information on all of the specifics in terms of eligibility requirements and how often, if it's not just a one-time payout, how often it would be distributed. Now I'll focus a little bit more on the admissions process, which can be intimidating and confusing, especially when you try to compare different programs or are unsure about prerequisites. And the goal for this portion is really to help alleviate some of that anxiety that the students may have and to leave them with a better understanding of what we require here at our program so that you can also share that with your students. So the first hurdle that applicants must pass is the GPA requirement. It's a 3.0 minimum for both cumulative and the science GPA, and this is calculated by CASPA based on the transcripts, the official transcripts that get uploaded onto the Common App for our PAs. If there's any specific questions in terms of how that's calculated, there is an FAQ section on their website that's very helpful. We do get a lot of questions in terms of can GPAs be recalculated after potentially that they've taken more courses since they've applied. We only base our GPA requirements off of CASPA at the time that the application is submitted. The degree that we require is just a baccalaureate degree from an accredited institution. It doesn't have to be complete before they apply for the program. They just have to be completed before they would matriculate. And we don't have a specific degree or discipline that we're looking for. All academic disciplines are accepted. So like our degree requirement, all the prerequisite work must be completed at a regionally accredited college or university, and you can find that updated list on our prerequisites page of our website. And then any of our prerequisite courses have to be completed with a grade of a C or higher, and a special exception is specified on the website to cover courses that were taken during the COVID pandemic, and there's a special caveat that may or may not apply. But it is important to note for your students that We do not accept AP or IB credits to fulfill prerequisites, and it may be useful to double check that with your advisees if this situation applies to them, as they may need to retake courses before applying or matriculating. First of the prerequisite courses are those that are required prior to application. I'll cover those first. Chemistry, either 8 semester or 12 quarter hours, general chemistry or higher, and specifically for science majors. And one of the courses must include a lab. For biology, applicants need 14 semester or 20 quarter hour credits, and these courses must be designed for science majors and must include at least one lab. They need to be taken through biology or equivalent department, and the courses need to be related to medical and or animal sciences. We've listed a few recommended courses, but these are not required. It's just easier for us to see these and know specifically on a transcript that they are more likely than not to be used towards fulfilling this biology requirement. Specifically, nursing, kinesiology, exercise science courses are not accepted to fulfill the biology prerequisite. Underneath the overall biology section, we have a subsection of 6 semester or 8 to 9 quarter hours of upper division biology courses completed within the last 5 years. And these upper division means 300 or 3000 level or higher, though some colleges and universities have different course numbering systems. It is important to note community colleges do not offer upper division courses, so community college courses cannot count towards this specific requirement. Another subsection of the biology requirement is anatomy and physiology. So for these, we need at least 6 semester or 8 quarter hours, and it must include at least 1 semester of each system-based physiology and anatomy, or 1 full year of combined anatomy and physiology, specifically for science majors. And although it's not required, we do recommend upper division courses with labs to better prepare for the academic rigor of our program. And if they are upper division courses that are taken, those can be used to fulfill the upper division requirement. The courses that are required prior to matriculation. So these are not required before an applicant can apply to our program, but if they are accepted, these will be required to be completed before they can matriculate. So first is genetics, and this is either a 3 semester or 4 quarter hour credit of either general or human genetics specifically. Courses that are designed for science majors, and we do not accept molecular genetics for this purpose. It is important to note that genetics cannot be used to fulfill the biology prerequisite credit hours or either the upper division requirement. Next set of courses is for psychology. This one is either 6 semester or 8 to 9 quarter hours. We do have a couple of recommended courses, including general, developmental, or abnormal psychology. And then the last one is statistics. This one is 3 semester or 4 quarter hours and can be taken in any department. What do we consider a complete application? First, we need a verified CASPA application that includes 3 letters of recommendation. Second is the CHA program supplemental application and fee. And third is the CASPA score. And the results for these are only valid for 1 admission cycle, so if one of your advisees has taken the CASPA test for the last cycle, they will need to redo it for this upcoming cycle. Another important thing to note is that our admissions team does not look at incomplete files, so it's crucial that applicants take this into account when they're planning how and when to apply, as some of the pieces, like the CASPA tests, are only offered on a limited number of test dates and times, and like CASPA, that can take several weeks to get their application verified once it is submitted. These deadlines are available as well on our website, but generally the cycle goes like this. We'll start in mid-April for CASPA. Their application will go live, And then our supplemental application comes online about a month later in mid-May. Our cutoff date for completed application submission is September 1st, and the only caveat for this one is that an applicant's CASPA application could still be waiting on the verified status to change over. And then our classes begin on the first business day in July. And here's a quick look at our admissions process. To start out, we have to receive the completed application. Then one of our admissions team will double check that an applicant meets our minimum requirements and prerequisites. If an applicant doesn't meet these thresholds, they will be notified shortly by email thereafter that they have been declined and the reason why. And after the prerequisite checks, the file moves on to the faculty review stage, and the highest scoring applicants will receive an invitation to interview with us in person. Interviews are conducted during one of 4 interview days held on campus from August through October, and each day has 36 spots available. A portion of the attendees will find out their admission decision, either accepted or denied, within the next week. And then all remaining admissions decisions are sent out, usually in early November. So a super important question that we get a lot: what makes a competitive applicant? It's a really simple answer for the first part that most people are like, yeah, duh, obviously. Completion of appropriate prerequisites. Each cycle we receive about 20 to 25% of applications that don't meet our minimum requirements, either for GPA or prerequisite courses, and I feel terrible because it really is a waste of the applicant's time and money in applying to our program without understanding what is required. Next, file reviewers look for academic potential and previous achievement, and while the scholastic portion of the review is not the entirety of the score, it can be a very good indicator of how likely an applicant is to succeed in our program. For applicants who may have started out undergrad on the lower end of the GPA scale, but have shown great improvement, we do look at the last 45 credit hour GPA in conjunction with science and the overall GPA to get a better picture of scholastic aptitude. And this can also be a good topic to discuss in personal statements and essays to give more context to a lower GPA. Character is best expressed through letters of recommendation, personal statement, and essays. We really want to know who the applicant is as a whole person, not just their class ranking or how they did in terms of grades in undergrad. And this ties into the next piece, which is communicating to the file reviewer and interviewer that the applicant knows what a PA is and what they do in the clinical sense, and why they want to join the profession as a goal. If the applicant can also tie this into life, work, and volunteer experiences, and connect all of that to our mission in some way, it can be very helpful in expressing commitment over the long term. We are focused on quality of experiences, not necessarily the quantity of them. And it is important to note that our program does not require a specific number of healthcare experience hours, though having time shadowing a PA or other healthcare experiences in general can be useful in the sense that it can help form what is the motivating factor for joining the profession. Here we've got a little breakdown for the statistics for our newest incoming class. This breakdown is available on our website for the previous 3 cohorts, and we update this every year as more and more are added. You can see that it is heavily skewed towards women, and the age range is a little bit lower. For us, since we are a 3-year program that doesn't require any healthcare experience, we do get a lot of younger applicants, especially right out of undergrad or maybe that take a gap year, and that this is the overall trend for most of the PA programs nationwide. You can see on the bottom right that the median experience hours are shown. Even though they're not required, we do show this so that applicants can get a sense of where our current students are in terms of shadowing hours, volunteer, patient, and health-related experiences. Before I finish up, I do want to include some tips for applicants. First, cannot recommend enough that they use the prerequisite worksheet on our prerequisite website. It does visually organize all of our prerequisites into a fillable form that can make it clear to the applicant and any advisors who might be helping them what courses could be missing or that still need to be added. Working through this sheet can also answer a lot of questions, but if there are any questions related to whether a specific course can be given or be used for a given prerequisite, please advise your students to send a link to that specific course description so our admissions team can make that determination more easily. Next, really stress that letters of reference should be written by people who can speak to an applicant's character, work ethic, and drive. File reviewers would rather have a heartfelt and honestly written letter from somebody who has known the applicant for several years rather than a random healthcare provider who the applicant shadowed maybe once for 5 hours. And this is to say that the letter of reference doesn't have to be connected to the healthcare industry at all. It doesn't get weighted any differently for scoring or ranking purposes. And since our program uses rolling admissions, it is highly advantageous to apply early in the cycle. Applicants will be compared to a smaller number of total applicants, and this increases their chances of being selected for an interview as long as they meet our minimum requirements. Additionally, there is not a specific order that the required materials need to be submitted, and students can check status updates on the supplemental application starting in mid-May. Finally, students should practice interviewing with advisors, friends, family, so that they can get more comfortable in an interviewing mindset and articulating their answers concisely and thoughtfully without worrying about nerves getting in the way. There is a wealth of information available on the prospective student website, including the information in this presentation. If you or your students have any questions, the best way to contact us is to reach out by email. Thank you for taking the time to watch this presentation and learn more about the CHA program here at the University of Colorado.